Okay, so good evening. We will start the microbiology. Microbiology in England is including also parasitology. Of course, not common parasitology disease in England, but what we have in England is the diseases which is have surgical importance, like hydatid cyst or something like that. So all these are important from surgical point of view. In exam, we have 7 questions. In the real exam, we have 7 questions in macrobiology. So it is a good bulk of question, and this question also including you have some question about antibiotic in the pharmacology part, and is also related to microbiology. So I start first question is a 72 years old man with peripheral vascular disease develop a gangrenous toe. He become infected and there is evidence of infection in the surrounding tissue. On palpation, there are crepitus present within the tissue. What is the following organism is the causative agent? So this question, he need to ask which is organism can cause gas gangrene because the patient have crepitus. So what is your answer?
It is Clostridium perfringens.
Yeah, good. It is Clostridium perfringens or Clostridium wilshire. Gas gangrene can cause by 3 Clostridium wilshire or perfringens, Clostridium septicum, and Clostridium gangrenosum. You know what is Clostridium difficile cause?
Difficile cause is Corynebacterium diphtheria. Pseudomembranosus colitis. No,
Pseudomembranous colitis. Okay.
colitis. Yeah.
Of course, Clostridium tetanitis tetanus. Okay. Next question. A 22 years old lady breastfeeding in her first child. 1 week postpartum, she presented with tender, diffuse, indurated right breast. Which of the following organism is the causative agent? First, before we start, so this is lady have diffuse induration, so it is mastitis. It become localized, we called it abscess. So what organism can cause mastitis or abscess? So which one?
Staph aureus.
Yes, correct. Staph aureus is a causative organism. Of course, the other is not related. Next question, and is important. A 45 years old man is recovering in the hospital following total hip replacement. He developed profuse diarrhea, no fever, and no vomiting, most probably due to prolonged use of clindamycin. Clindamycin is antibiotic. In some country, we called it dalacin C, and common use in dental abscess. Which of the following organism is the causative agent? So this patient have diarrhea. This usually bloody diarrhea, and this is what we called it pseudomembranous coli. So he need to ask if this patient take antibiotic and have pseudomembranous coli. Again, what is the organism?
Then it's difficile, right? Clostridium
Yes,
difficile.
yes, it is Clostridium difficile. This one D, Clostridium difficile. Okay. 45 years old woman presented with ulcerated mass in the cervix. A biopsy is taken. Histology demonstrates squamous cell carcinoma. You know that is a cancer cervix is type of metaplasia because the lining epithelia in the cervix is stratified columnar. So it become after metaplasia, which is precancerous, becomes squamous cell carcinoma or stratified squamous. It is the reverse of happened in the lower esophagus, which is stratified columnar and become stratified squamous normal in esophagus and becomes stratified columnar. So here we speak about cancer cervix. What if the following virus is likely to be the cause?
HPV 16 and 18.
Yes, human papillomavirus 16 and 18 is the causes. We have many type of human papillomavirus, but 16 and 17 is responsible for cancer cervix. And nowadays we have vaccination against human papillomavirus, so this is reduce the percentage or the number of cases have cancer cervix in many countries. 6 years old boy presented with symptom of recurrent pruritus in eye. On examination, there is evidence of a small worm-like structure protruded from anus. Which of the following parasite could be the cause? This is tiny worm. We called it pinworm. Pinworm is the trade name, but in the medical name or the scientific name, which one can cause parasite
Parabia
in anus?
vermicularis.
So Inotropias firmicularis, and we usually called it pin. It is like a pin worm, is pin-like. Okay. 58 years old man had a renal transplant 1 year ago. He has been able to return to his work. Over the past week, he reported that he has been suffering from recurrent episode of diarrhea. Of course, if the patient have renal transplantation, so he's an immunocompromised agent to avoid rejection. So this is organism usually occur in immunocompromised patients. We called it opportunistic infection, and the most of them are rare organisms. Not common in our practice. It has made him feel lethargic and exhausted. Stool microscopy show evidence of a cyst. So which of the following parasite could be? So he needs something, parasite, not common, but can cause diarrhea in immunocompromised patient. In normal people, don't use that.
It's Cryptosporidium.
Yes, Cryptosporidium infection, it is a common, and it is also can be blamed in some of the traveler diarrhea occur in some foreigner who went travel from Europe to tropical area. By the way, Colonorchis sinensis is a parasite common in China and can cause common bile duct obstruction, and it is present in some sort of fish in China. So it is one of parasite can occur in common bile duct. It's very rare but common in China. Next question, 25 years old man returned from backpacking holiday in India. He's presented with symptom of cough, abdominal discomfort, perianal examination is normal, stool microscopy demonstrate both worm and egg within the feces. So this is parasite, have worm and egg. Which of the following parasite can be the cause? Is something affect gastrointestinal tract and can cause diarrhea. So which one?
Ascariasis, Ascaris lumbricoides.
Yeah, so Ascaris is common in tropical area. Of course, India is a big country and they have different reasons, and most of the tropical disease and the non-tropical disease present there because of the huge size of India. So the answer is Ascaris lumbricoid infection. By the way, Ascaris in some country, like in Middle East, can also cause obstructive jaundice and can present it in common bile duct. All right, next question. 29 years old female undergo subtotal thyroidectomy. 5 days post-operative, the wound becomes erythematous, discharge pus. What most likely the cause of organism?
Staph aureus.
Yeah,
Pus,
so it is just wound infection. Of course, thyroidectomy is a clean operation. The rate of infection is very rare, can be reach 2 to 5% maximum, but if happened, so usually it is a skin commensal staph aureus. Which organism is most likely cause acute osteomyelitis in children with sickle cell disease? This is very common question, common in exam. For me, first, I found it is strange because uh, acute osteomyelitis in patient with sickle cell anemia, uh, usually acute osteomyelitis in normal people, they can be just normal organism like staph and other. But in sickle cell anemia is different. What is your opinion?
Salmonella. I saw
Yes.
that they said septic arthritis in children with sickle cell disease will present with salmonella.
Yeah, although it is very rare as is not common, but they found in the patient with sickle cell anemia, if have osteomyelitis or septic arthritis, they found the organism is Salmonella typhi. Although it's common the Salmonella in many countries cause typhoid fever, but in some area in the sickle cell anemia, they can cause osteomyelitis. Actually, sickle cell anemia is related to some disease and the relation is unknown. Like they found sickle cell patient is have resistant to malaria in some country. So still unclear the relation of the patient with sickle cell disease and some infectious disease. Next is a 22 years old female is admitted to hospital with mild jaundice, enlarged spleen, no hematemesis, so it is not a varices. What infection can cause splenomegaly? So this patient have splenomegaly and mild jaundice. What it could be? If we become more easy, they have some lymph nodes. So they have lymphadenopathy, they have splenomegaly, maybe mild enlarged liver, jaundice. So what it could be?
Epstein-Barr virus.
Yeah, it is infection mononucleosis. Infection mononucleosis can cause splenomegaly, can cause jaundice. Epstein-Barr virus is the main cause or the causative agent for infection mononucleosis. It is remember to know that Epstein-Barr virus in some country, like in China, can cause nasopharyngeal carcinoma, and in other country, like in Africa, can cause Burkitt lymphoma. Next question. 11, 22 years old man presented with 5-day history of sore throat, malaise, fatigue. On examination, they have enlarged pre-tonsillar abscess. What is most likely underlying infectious organism? So it is just tonsillitis or tonsillar abscess. So what is the cause? Anyone have an idea?
Strep pyogenes.
Yes, correct. The streptobiogenes is the cause of the tonsillitis or pretonsillar abscess. Next question is tricky. Speak about an elderly woman attend an elective surgical procedure, have a productive cough. She has recently returned from a holiday in Spain, and he had nausea, vomiting, and diarrhea. The trick here, till 1986, we don't know bacteria can cause chest infection and diarrhea. We don't know bacteria can affect both respiratory and gastrointestinal. Till in 1986, in the conference in Japan, this is conference for all the people working in army, and they found at the end of the conference, most of the attendants have diarrhea and chest infection, which has never happened before. So at this time, we called it the disease is Legionnaire disease. Legionnaire in Japanese language means a conference. It means that the disease of the conference. After that, they found the organism and they called it Legionella, and it is one of the cucubacilli. And they found later, and it is come from the air condition, especially central air condition, and this air condition filter have this is organism. So this is why when we mention this patient, we say it is in Spain because, of course, in Europe, in like UK, they don't have air condition; they have heater. But he need a country they have air condition because this disease is common in air condition. So it is occur in area like Middle East, Southeast Asia, uh, south of the Europe because this is area use the air condition. So the answer here is Legionella and the bacteria is Cucubacilli. Actually, 1986 is not much long, but it is one of the recent bacteria discovered, and it's called Legionella. Next question is about medication, and again in the exam we have some question about the pharmacology. Most of these question either related to antibiotic or treatment of peptic ulcer. So, for example, 52 years old woman has recurrent retroalular abscess in her right breast. She is chronic smoker. Which of the following antibiotics suitable for her? This is also is tricky because what you expected this patient have? Anyone? What is the diagnosis?
Could it be ductal of the breast?
Say again?
Duct, ductal ectasia of.
Yeah, this patient have duct ectasia. Duct ectasia is common in the female which is chronic smoker. Duct ectasia is different than the normal or ordinary or traditional abscess in breast. In traditional abscess of breast, you can give fluoxetine, you can give penicillin, but this is duct ectasia usually have anaerobic organism. So here the treatment is metronidazole. So this is due to anaerobic organism in duct ectasia. So give metronidazole. So the answer is metronidazole. Next question is about an infant with cellulitis in the right side for the past 2 days. What's the following antibiotic suitable to treat this condition? So we speak about skin infection. So normal skin commensals. So usually we give something related to penicillin group. So anyone have suggestion? Actually, it is fluoxetine. Fluoxetine is one of the broad spectrum and can cause any skin infection. Next question is also in the same topics. Is 24 years old, a lactating lady, have a fever and pain. She is young, pain in the left breast. We don't mention that it is chronic smoker. On examination, they found have tender, firm inflammatory mass, so she has an abscess. What is the following antibiotic suitable for her condition? Here, this patient is have an abscess in her breast. So the same also, we give her fluoxetine. Of course, if the patient, of course, this is breast, is we don't use for lactation. She lactated from other breast. Usually, cephalosporin is the safe, but cephalosporin not mentioned here, so we choose fluoxetine. Next question, a 30 years old man complained of dysuria for 1 week. Urine examination refer pass. What's the following antibiotic suitable to treat this condition? Of course, in the UTI, usually we use Tylenol group of antibiotic. So levofloxacin is one of the group. It is important to know in the basic science of the MRCS by Andrew Raftery in the end chapter of pathology, they write about mechanism of the action of antibiotic. So you can read it, and also in the answer sheet, I give it to you. Which following antibiotic is contraindicated in pregnant women? Is anyone know this? Because it is look easy. Anyone?
Tetracycline.
Okay, tetracycline, because you know tetracycline can cause red teeth, so tetracycline is contraindicated in pregnant women. Of course, we don't use it now except for chlamydia. Next question, which of the following antibiotic act as inhibitor of nucleic acid synthesis in bacteria? Of course, may be difficult, but the mechanism of action of antibiotic, some antibiotic act in the cell wall, some act in the cell membrane, some act in nucleic acid synthesis. The common act in the nucleic acid synthesis is rifampicin group. So the answer here is rifampicin. Which of the following antibiotic is used with caution and the close monitor level in the patient with renal impairment? So here they need to ask about which antibiotic is nephrotoxic, so contraindicated in the renal disease. Of course, we know that aminoglycoside group is nephrotoxic. Aminoglycoside, garamycin, gentamicin, amikins, all these are nephrotoxic. Although it is common in past use in urinary tract infection, nowadays Tylenol have the top. Which of the following antibiotic used as a prophylaxis in abdominal surgery? Here we speak in general. We don't say intestinal anastomosis. We don't say colonic surgery. We don't say strangulated hernia. So it is just like simple operation like normal gallbladder removal without perforation of the gallbladder. So in the simple surgery in the abdomen, what is the prophylaxis you give? Anyone? Okay, so usually what we give is cephalosporin, but if the intestine or opens the small intestine or large intestine or the gallbladder perforated during surgery, we add metronidazole. So the answer here is cephalosporin. Which of the following antibiotic effective against chlamydia pelvic infection? Again, chlamydia is the treatment is tetracycline. And chlamydia nowadays caused sexual transmitted disease, and in past it is famous to cause trachoma, which is the eye infection. So chlamydia, whatever affects the eye or affects genitalia, the treatment is tetracycline. Of course, in the eye disease, we give eye ointment. Which of the following antibiotic is effective against both aerobic and anaerobic? So to mention, it is against aerobic and anaerobic, so you must have a combination. So the combination like cephalosporin and metronidazole, or can be like this co-amoxicillin, which is augmentin, which is amoxicillin and clavulanic acid. Next question. 23, 55 years old woman, diabetic, developed acute spreading cellulitis in one thigh. 1 week after drainage of perianal abscess, she became ill with rigor and fever. Affected skin appear blisters. Which of the following appropriate diagnosis? So this is complication. Usually, one of the common complication in perianal abscess or scrotal abscess or abscess in this area in male and female is necrotizing fasciitis. This necrotizing fasciitis, if occur in scrotum, we call it Fournier gangrene. But if occur in thigh or any area, we call it necrotizing fasciitis. Next question, and it is also come more frequent in ENT chapter in the part 2, in the paper 2. A 45 years old patient came to emergency department with complaint of airway obstruction due to bilateral infection of the submandibular and submental space after dental sepsis, diagnosed as Ludwig angina. So Ludwig angina is occur in the inflammation in this area. So if you have inflammation in the area of the submental, which is including submandibular salivary gland and submental and submandibular lymph node, all this area, we called it sublingual, we called it Ludwig angina. Ludwig angina is dangerous because in short neck people can cause suffocation and they need tracheostomy, and this is why it is one of the indication of admit the patient in dentist if the patient have big abscess or infected abscess in the mandible, so must be admitted because Ludwig angina is dangerous and can cause a lot of the trouble and can cause suffocation. So the causative organism of the Ludwig angina is Streptococcus viridanis. So the answer is here is E, Streptococcus viridanis. After that, we have another type is related also ENT. So 55 years old woman, diabetic, developed fever, pharyngeal infection and ulceration or ulcerative. What is the following diagnosis? Pharyngeal infection, we called it Vincent angina. So to differentiate, if occur in this area, we called it Ludwig angina. If occur in the upper part of the pharynx, we called it Vincent angina, and the organism is called also Ventis morellini. So this is Ventis angina. Next question, and it's come many time, and we stay about 10 years, no one answer it, although we have many good surgeon. What is the following method used for sterilization of surgical suture? You know, suture came from factory sterile. So what you expected the factory do for sterilization of this suture? Anyone have an idea? Of course, you use a lot of suture, but anyone have an idea what is material or what is the methods in factory used for sterilization of suture? Anyone? Sometimes in exam we found surgeon, he maybe work for many years, and of course he use thousands of suture and he don't know what use for sterilization. Actually, surgical suture is sterile by ethylene oxide in factory. Gamma radiation used for syringe and plastic, like nasogastric tube and other. In factory also. Glutaraldehyde is a Sidex used for laparoscopy. Iodine used for skin, like bovidine iodine for preparation of the skin, not sterilization. Steam with formaldehyde is used for cleaning or sterilization a room. So again, ethylene oxide for suture and also can use for some urology endoscopy. Gamma radiation for plastic like syringe or nasogastric tube or catheter. Glutaraldehyde Sidex for laparoscope instrument. Iodine for cleaning, not sterilization of the skin like bovidine iodine. Steam with formaldehyde for cleaning the room. Okay, so it
Prof,
is important.
Prof, ethylene
Yes.
oxide you said just now for what? Urology instruments?
Yeah, because you know, urology endoscope is a combination of the glasses and the metal and the plastic. So they use ethylene oxide. Maybe the new
Okay.
generation maybe modified like laparoscope, but our laparoscope, because laparoscope is recent, so our laparoscope they can separate it, camera alone, cable alone, so we can put inside it. But endoscope for the urology is some complicated. So some use ethylene oxide, some use glacial acetic acid. So it is more complicated because have a lot of lenses, not like what we use in laparoscopic surgery in general surgery. Okay.
Okay, Prof.
All right. Again, so they can found what is the following methods used for disinfection laparoscopy. So now it is clear what we use is
CDAX.
Sidex or glutaraldehyde. Of course, Sidex is a trade name. Of course, the Sidex you put a solution concentrated and diluted in some percentage of water. Last question is little tricky. What is the following methods used for sterilization that monitoring using Boyne-Dick test? Boyne-Dick test is indicator tape. I think I put the picture maybe in the answer sheet. So we have, I show you the picture. So this is indicator tape. If you see the an instrument in surgery, they have indicator tape. This is tape usually is used by autoclave. So in the autoclave, to put the instrument in the autoclave, they have a special paper and a special tape. I will show you soon. After that, I just show you the shape. Of course, you see it many times. I share the screen again. Okay, you see, of course, this tape in the operative theater before. You see it. Okay, this tape is a picture is first have no mark. The mark is white color. If we put it in autoclave for 35 minutes, autoclave is the temperature maybe 135 for 21 minutes. So it's become brown. So mean it is sterile. Okay. All right. This is, as you see, the mechanism of action of antibiotic. Antibiotic can act in the cell wall like penicillin, ampicillin, cephalosporin, vancomycin. And this is explained if the patient is sensitive or allergic to penicillin, if you give it him cephalosporin, you need to do a sensitivity test. Inhibition of protein senses like tetracycline, chloramaphenicol, erythromycin, clindamycin, aminoglycoside. Inhibition of nucleic acid senses like sulfonamide, trimethoprim, quinol, which is common use in the urology now, or UTI infection, metronidazole, flagyl, and rifampicin. Acting on the cell membrane, polymyxin, and it is dangerous and not common use, is very, very rare to use. I think is obsolete now. So usually we have something acting cell wall, protein synthesis, and the nucleic acid. Okay, so back again to last question, because this last question is coming in the last two exam and have a lot of debate. And this question is asked about human oral flora account for greater morbidity of human bites. Which of one of the following organism is present in human bite? Actually, for me, this question is difficult. It came in just this year in January for first time, and they write all these organisms. Anyone have an idea what about organism present in human bite?
Ichinella corroded. Jay told me about this question.
Okay, all right. So Echinella cordyceps is the name of scientist, and he discovered recently this is bacteria in human mouse, and he have an idea. He say even in Billion Love, the human bite is more dangerous than animal bite because human mouse have a lot of bacteria. Okay, because you know the human eat a lot of things, so they have a lot of bacteria. Okay, so aerobic and anaerobic, we can have a lot of bacteria, but Echinella cordyceps is a bacteria which is present nowadays in the human or discovered nowadays in human bite. Okay, this is tricky question, but usually in exams they have something like that, just for. Uh, uh, just to be up to date. It is not important from surgical point of view, but just to have an idea about that. Okay. So this is as regard first, what we test is the as regard microbiology. After that, we still have a time, so I speak about physiology. Of course, physiology, yes.
Prof, can I ask about the question 13? Just now you mentioned the chronic smoker in a woman with retroareolar abscess.
Yes. Is
Yeah,
an actually they
it's not,
found
but it's not duct
okay.
ectasia, right? It's periductal mastitis, right?
No, they have two names for duct ectasia. If it occur in young age, we called it subaerial abscess. In the past, we called it plasma cell mastitis. If it occur in non-lactating old woman, we called it duct ectasia. But both occur in chronic smoker. So if it occur over age of 50, so it is duct ectasia. If it occur in younger lactating, we called it subaerial abscess, or in the past, plasma cell mastitis. So you can find even in other recall or other sheet, they have this question twice. One in the lady is 30 and one in the lady is 50. Inshallah, in the other sheet, what we called it Fawzia sheet, we have this version of this question, so we discuss it with you. I can send it to you separate. Okay. So now we will go to physiology. Physiology in exam is easy. As we see before, as we mentioned before, in pathology, you can find the most of topic of pathology like thyroid, like cancer thyroid, cancer colon, also can come to you in the surgery. Physiology question can be some ask about endocrine, can some ask about blood gases, some ask about GIT secretion, and the same. So it is combination between many topics. So it is difficult to know if this question is related to physiology or related to pathology or related to surgery, because this is just general topics. Of course, liver function test, all these endocrine function of all gland, all the pancreatic function, all these is can consider physiology. Of course, it is also applied surgery. All right. So we start by question. We don't have much question, although an exam is supposed to be 45, but because of the most of the questions speak about endocrine, so you can find it is like easy for you. Of course, the kidney is important also. So we start in physiology. So we have 23 years old, stabbed in the groin, develop hypovolemic shock. What's the most likely finding in urine analysis? So if the patient of shock, so they have salt water retention. So what do you expect specific gravity? Anyone got an answer?
Increase.
Yeah, so it is increased specific gravity. Of course, in the body response, of course, most of the physiology question is related to body response in shock and the trauma and the hemorrhage. So they have salt water retention. If we speak about urine, from urine point of view, specific gravity is increasing. Okay. 45 years old male diagnosed as carcinoma of head of pancreas. He reported his stool stick on the toilet and will not flush away. So we have steatory. Loss of which of the following enzyme is responsible for this problem? So we know that it is steatorrhea. Of course, pancreas is responsible for everything, for carbohydrate, for protein, for lipids. So all these are correct. So lipase, amylase, trypsin, elastin are present in pancreas. It is an enzyme from pancreas. Of course, insulin also as a hormone. But he asked, what is cause misdigestion of the fat? So cause steatorrhea. So lack of which, anyone?
Lipase.
Lipase. So make it easy. So lipase, because we speak about fat, so they become sticky, and this is steatorrhea, so is lack of lipase. Of course, just this scenario is not important if he mentioned if the patient has steatorrhea or what is responsible for in digestion of fat in pancreas, so it is a lipase. 34 years old man received morphine following an appendectomy. He developed constipation as a result. Of course, you know that morphine have many side effects. He can cause paralytic ileus, he can cause respiratory depression, and the antidote of morphine is, anyone knows the antidote of morphine? Started by N.
Naloxone.
Naloxone. Okay. So patient have a morphine, so he just need to ask which receptor is affected by morphine. So we have DOPA receptor, mu receptor, serotonin release, something like that. So which receptor is affected by morphine in CNS? So the answer is
The mu receptors are
yeah,
stimulated.
mu receptor. Mu receptor is one of muscarinic receptors, so it is mu receptor. Is easy. Next question, 56 years old male presented to the emergency department with severe abdominal pain. He's normally fit and well. He has no malignancy. The biochemistry lab contacted in the ward urgently, corrected calcium. So the calcium is 3.6. 3.6 is low. The normal value usually written in exam. What medication in addition to intravenous fluid used to treat this condition? Sorry, 3.6 is very high because we measure it is maximum 2.5 millimole. We speak about millimole. In some country, we use milligram. Milligram is higher. It is from 8 to 10 milligram, 2 to 2.5 millimole. So this patient have no malignancy and have high calcium. We mention no malignancy because with osteolytic lesion like breast cancer, if we have secondaries in the bone, the patient have calcinuria or hypercalcemia. So this patient have hypercalcemia. First line of treatment in hypercalcemia is intravenous fluid. You must give intravenous fluid. So suppose I write which medication is given or what is given to the patient. I don't write intravenous fluid and the written here in the choice. So the answer is intravenous fluid. So after intravenous fluid, you need to give something called the calcium chelator. So which one of these you can give it for hypercalcemia in non-malignant patient? Of course, you know that zoledronate is given for malignant hypercalcemia, but for non-malignancy, we give just a simple calcium chelator, which is babindoronate or intravenous babindoronate. It is something like diphosphonate and biphosphonate. Okay, so the answer is this is intravenous babindoronate. The other is also chelator apart from doxycyclines and this, but it is used in other situation. Of course, the calcitonin is not a drug; it is a hormone from parathyroid gland. Second, the topic which is important in the physiology, I maybe send you at the end summary of the important topic in ECG is ECG, simple ECG. So, for example, what is BQRST represented? So, for example, this simple question, which is normal ECG represented ventricular repolarization. So, what is ventricular repolarization? We know ventricular depolarization is QRS complex. What is ventricular repolarization is? Anyone?
The T wave.
Yes, of course. So QRS is depolarization of the ventricle and the repolarization is T wave. So it is important to know details of this ECG, just enumeration. 28 years old man is shot in his abdomen and had hemorrhage. What if the following substance produce vasoconstriction in response to trauma? Of course, body response to trauma, we have renin, angiotensin, aldosterone system. So all are correct, but what is the main principle or the main substance for vasoconstriction? So it is, of course, renin secreted, renal it reduce angiotensin 2, so the main vasoconstrictor here is angiotensin 2. After that, aldosterone is released. Next question, and it is important also because he asked about this curve, which is jugular venous pressure, which is A, C, V, and X and Y. 43 years old lady in recovering from intensive care unit following Whipple procedures. She has a central venous line in situ. What the following lead to Y descent of the waveform trace? Of course, you know that they have this Y, X and Y. So this Y. So what this Y for? Okay. Although it is look easy, but just remind you, we have first is A wave. A, just remember A, it is for atrial contraction. And followed by C. And C is ventricular contraction. In ventricular contraction, the tricuspid valve become up, so make the space or the atrium is less space. And the last V shape, it is arterial venous filling of the atrium again. So we have two down, X and Y. So this is X, is usually it is atrial relaxation and tricuspid valve move down, and Y for ventricular filling. So here he asked about Y. So he asked about Y. So the answer is ventricular filling. Ventricular filling, it means that empty of the right atrium, so the ventricular become filling. So the answer here is emptying of the right atrium. So the blood from right atrium go to the right ventricle, and this is cause the Y descent in the jugular venous pulse. So again, we have three positive, we have A, we have C, we have V, and we have two down, X and Y. Okay. I make a summary for this just to be easy to remember. Next, and it's important also, respiratory function test. 25 years old man undergoing respiratory spirometer. He take maximum inspiration followed by maximum expiration or inhale. What's the following measurement best illustrates this process? Of course, if you see the curve here, This curve is tidal volume, inspiratory, then expiratory reserve volume. So if the patient take maximum inspiration, maximum expiration, so this is all this value, what we call it vital capacity. The other values like total lung capacity is equal to residual volume, and it is measured by helium dilution. So we have tidal volume, inspiratory, expiratory, reserve volume, all is called vital capacity. Function residual capacity is expiratory reserve and residual volume, called it function residual capacity. Okay. So the total here, or full inspiration followed by maximum expiration, is vital capacity. Some question is easy like this, not little tricky. What is the typical stroke volume in the resting 70 kilo man? You know, stroke volume is fixed. Whatever your size, whatever you're tall, whatever you are short or big or overweight or not overweight, the stroke volume is 70 milli. In 70 kilo, in 100 kilo, in 200 kilo, the stroke volume is dependent on the heart. The heart in overweight person or obese person not bigger. So stroke volume is amount of the blood pumped by each ventricle in the each ventricular contraction, and it is 70 mil. Okay. Next question, 25 years old man undergo appendectomy for acute appendicitis. Appendix is submitted to histopathological evaluation. What's the following most likely cell identify microscopic? Of course, it is easy. What in the patient with acute appendicitis, what cell is increased? Anyone? Think simple, in simple way.
Neutrophils.
Neutrophil. Okay, so this is sometimes the question is so simple, so the student found that is maybe unexpected, maybe something rare. This is simple infection, acute appendicitis, so the answer is neutrophil. Again, we back to something related to cardiology. 73 years old man, he has arterial line in situ. In a study that raise incisora can be seen. What physiological event account for this process? So actually, this is a picture. This is a aortic systolic blood pressure and diastolic blood pressure, and you can find this is some notch here. This is notch, we called it incisora. This incisora is the notch in the arteriogram or the arterial line measurement. So this is just a symbol. So this is incisora, of course, contraction and relaxation, but this is just elastic recoil after at aortic valve closure. So this is due to elastic recoil. Okay? And this is the explain for that. Next question. 22 years old man suffer from blunt head injury. He is drowsy. Glasgow scale is 7 on admission. Of course, you know that if Glasgow scale below 8, you must intubate the patient. What is the following is the major determinant of cerebral blood flow? You know that we have equation for cerebral blood flow. This is equation is very important, and you know that cerebral blood flow is equal mean arterial pressure minus intracranial pressure. So who is determined the main cerebral blood flow is after the minus, which is intracranial pressure. Usually intracranial pressure is about 17, 18 milligram, millimeter mercury. Okay. A main arterial blood pressure, of course, you know that it is diastolic pressure plus 1/3 or the third of pulse pressure. So cerebral blood flow is the main arterial blood pressure minus intracranial pressure. So the determined here is intracranial pressure. Next question. 43 years old man has recurrent episode of dyspepsia. treatment is commenced with oral anti-acid. So he take oral anti-acid. Which one of the following mediator is released in response for increased gastrin level and decreased intragastric pH? You know that mediator like acetylcholine, like serotonin, like this. So he just need to ask what is the mediator can cause secretion of HCl. Anyone? You know, in past, not now. Now the treatment of peptic ulcer is proton pump inhibitor, what we called it omeprazole. But in the past, one of the common treatment is something called H2 antagonist. H2 mean histamine 2 antagonist because we have two histamine. We have histamine in the mast cell due to allergy and H2 histamine 2 or type 2 occur in the stomach and responsible for HCl secretion. So the mediator for releasing of the HCl, whatever the cause, because many can simulate HCl like stress, like gastrin, like high calcium can increase gastrin and cause HCl to be high. So histamine is a mediator responsible for pH of the stomach and HCl or hydrochloric acid secretion. So the answer here is histamine. Of course, cholecystokinin pancreatozymin is a hormone responsible for contraction of the gallbladder during when you eat fatty meal. Okay, wound healing. So which one of the following cell type is the least likely to found in wound 1 week following injury? Of course, we know that the healing of wound is stages, started by hematoma due to bleeding, followed by inflammatory cell or infection, followed by something called devolution or the removal of dead cell, and after that contraction and healing. So, of course, this is first week is mainly hematoma formation, is mainly neutrophils. So the latest stage occur later, not in the first week, is contraction of the wound, and this is done by myofibroblast. Contraction means the wound becomes smaller due to formation of the myofibroblast, and it is occur more than 1 week. And it's in some big ulcer you can find the ulcer become contracted, become smaller. So this is by action of the myofibroblast and some collagen. So the answer here is myofibroblast. Next question, maybe little difficult. Which of the following is the mechanism of action of Barras hormone in increase calcium level? You know that calcium level or calcium is important in bone, is absorbed from intestine, deposit in the bone, and in some area it is by action of Barras hormone, like in the kidney, and in some area, like in intestine, is not under the action of Barras hormone. So is under actions in the activation. So activation of vitamin D increase in absorption of calcium from the small intestine. This is correct. Direct stimulation of osteoclast to release calcium from bone. This is incorrect, is not direct effect. Stimulation of phosphate absorption at distal convoluted tubule of the kidney. This is correct, but not in distal convoluted tubule because Barras hormone occur in proximal convoluted tubule mainly, not in distal. Distal convoluted tubule is the main action of aldosterone. Decreased permeability of the Bowman capsule of the calcium is not affected by Barras hormone in the kidney. Vasospasm of the afferent reduce the glomerular filtration rate is correct, but not by effect of Barras hormone. So the only answer here, the increased level, is the action of Barras hormone in the upper part of the small intestine, mainly in duodenum and upper jejunum. The other is not 100% correct. Sometimes in exam, like in this question, you can find the half the statement is correct. but he just changed distal instead of proximal or right convoluted or other parts, so become wrong. So it is important to know this. Next question. Easy, 65 years old man, chronic smoker, has recurrent episode of chest infection, was admitted to ICU. He then deteriorated. Was most likely cause of this patient deterioration? Of course, one of the big mistake we make is the doctor when the patient have head injury, don't give him high dose of oxygen, because one of the causes of simulation of his respiration is carbon dioxide. So what you expected the answer here? Anyone?
Over administration of oxygen in COPD
Yes,
patient.
correct. Correct. So it is important if patient have an injury or the patient is well known as chronic smoker, chronic obstructive airway or pulmonary disease, don't give him high dose of oxygen, because maybe the only simulation of respiration is a little high level of carbon dioxide. So over admission of oxygen, you can kill the patient. Okay, 43 years old man has nasogastric tube. Rial tube or nasogastric tube. The nurse take a sample for aspirated fluid from the stomach and test it for pH. Of course, we know the pH of the stomach is acidic. So which one of these is the pH of the stomach? Which one is acidic? Of course, acidic cut line is 4. So 4 and above 4 is not acidic. So 4, 5, 6 is wrong. So the answer is 1.5 to 3.5. This is the normal range of the pH of the stomach. Is not become more acidic, not 0.5. So it is usually between 0.5, 3.5. Okay. Of course, it is the acidic media. Okay. After that, shock, as usually, is a common question in exam. And of course, we know that we have the septic shock, neurogenic shock, hypovolemic shock, cardiogenic shock. So different type of shocks, so they can found in many ways. Of course, the septic shock is easy to diagnose by fever. And the patient usually in septic shock, the lower limb is warm and not very cold. The other type of shock you can find the periphery are very cold and the patient have no fever. So this is the easy way. Okay. So you can find the same scenarios like 45 years old man is admitted to ICU following a laparotomy. He has Swan-Gang catheter, arterial line inserted. The following results are obtained. Pulmonary artery occlusion is low, cardiac output is low, systemic vascular resistance is high, so it is not warm, so it is vasoconstriction. What one of the following is most likely diagnosis? So if the patient has this picture, so what it could be? Cardiac output low, blood pressure or pulmonary arterial pressure is low, and they have vasoconstriction in the lower limb and upper limb. So this is typical of what? Anyone? We have many type of shock. We have normal, we have septic shock, cardiogenic, hypovolemic. Cardiac output is low. Okay, so it is hypovolemic. We look into the second one, can see the difference. So this is hypovolemic shock. The same scenario, 75 years old man admitted to intensive care following a laparotomy. He has central line, Swan-Gang catheter, arterial line inserted. The following result. Pulmonary artery occlusion is high. Cardiac output is low. Systemic vascular resistance is high. So if we compare to the previous one, In hypovolemic, pulmonary arterial occlusion pressure or pulmonary artery occlusion pressure is low, here become high. Cardiac output low, systemic vascular resistance is high, so the patient have vasoconstriction. So in this situation, it is cardiogenic shock. So in cardiogenic shock, pulmonary artery occlusion pressure is high, the other cardiac output is low. Okay, so go to the next one. 22 years old lady admitted to intensive care unit following laparotomy. She is feverish. So fever. Central line pulmonary artery catheter, arterial line inserted. The following result is obtained. Pulmonary artery is low, so it is like hypovolemic. Cardiac output here is high, like hypovolemic. But systemic vascular resistance is low, not high, so this patient have vasodilatation. So this patient have vasodilatation, have fever, so straightforward, it is a case of what? Anyone?
Septic shock.
Septic shock. So again, if the patient have fever and systemic vascular resistance is low, septic shock. If the patient have pulmonary artery occlusion high, cardiac output low, systemic vascular resistance high, it is cardiogenic. If it is pulmonary artery occlusion low, cardiac output low, vascular resistance is high, so it is hypovolemic. So we have hypovolemic, we have cardiogenic, we have septic shock. Okay. Back again to receptor. So 22 years old lady received intravenous morphine for acute abdominal pain. What is the following best account for analgesic probability? It is the same like previous question. So we speak about morphine. So the analgesic must be bind to mu opiate receptor within the CNS. So the answer is again mu receptor. Which is the following area predominant concern with thermoregulation? This is easy, typical. What is responsible for regulation of the body temperature? And it is what? Anyone?
Hypothalamus.
Hypothalamus. So regulation of the body temperature is mainly the function of hypothalamus. Okay. The next question is very, very common. Of course, the question is coming every time by different scenario, but it's the same idea. 19 years old man is attacked with baseball bat. He sustained a blow in the right side of the head. He's brought to emergency department and put under observation. Glasgow scale deteriorated and become comatose. Okay, so in head injury, we have triad. We have something called Cushing reflex. This Cushing reflex, they have hypertension, bradycardia, and brady apnea, like respiratory become also brady. So the answer here, according to, because intracranial injury, according to Cushing reflex, so the patient must be hypertension and brady. So this is explained usually in trauma patients, usually hypotension due to bleeding, except the patient, if including head injury, you can found in some patients they become hypertensive and bradycardia. Okay, so this is important to know Cushing reflex. What is substance used to achieve the most accurate measurement of glomerular filtration rate? And also it is a common question in exam. How to measure the glomerular filtration rate? Anyone? So glomerular filtration rate, we use inulin because inulin not excreted in the kidneys, not absorbed or re-excreted from the kidneys, so inulin. But if you need to measure the plasma renal blood flow, we use para-aminobutyric acid. So glomerular filtration rate by inulin and renal blood flow by para-aminobutyric acid. Okay. Next question in the easy. 17 years old lady with long-standing anorexia nervosa is admitted for excision of lipoma. Which of the following nutrition deficiency is most likely to be implicated in poor collagen formation in the wound heal? So we just he need to ask which vitamin or which material is important for collagen or for wound healing. Of course, all the vitamin is important. Vitamin E is important for lining epithelia, but the important for collagen and the collagen synthesis and transform hydroproline to proline amino acid is vitamin C, which is L-ascorbic acid. So the answer is the poor collagen formation of the wound healing if the patient have deficiency of the ascorbic acid or vitamin C. Okay. Next question. 45 years old man undergoing small bowel resection. The anesthetist decide to admit intravenous fluid containing potassium electrolyte. What is the following solution matches the requirement? Of course, we have a lot of solution like saline, like ringal lactate, which is heart demand, like blood sugar, like glucose. But the only sodium chloride or saline is sodium chloride, so no potassium. So the only have potassium is ringal lactate or Hartmann solution. So the answer here is Hartmann solution. So anyone know why the last one is incorrect? Why this is not correct? What is E not correct? 500 milli, 5% dextrose. Till here is correct. We add potassium. So in one bottle of the dextrose, how much potassium we added? Maximum. Anyone have an idea what is the maximum? Of course, the maximum we added in one bottle is 5 millimole, not 40. 40 millimole is the total requirement per day. We have something called the rule of 40. Rule of 40 means that the maximum amount you can give to the patient per day for potassium is 40 millimole. Maximum is given within the day, not in one bottle. And of course, this patient must have at least 40 milli of urine per hour. So we call it rule of 40. We're about to finish. We have two questions. 16 years old girl developed pyelonephritis, suffer from septic shock. What of the following is not typically seen in this condition? Of course, this patient of shock, so increased cardiac output can increase systemic vascular resistance. Increase systemic vascular resistance mean vasoconstriction, and this patient have septic shock, so it is vasodilation, so it is decreased systemic vascular resistance. Oliguria, correct. Systemic cytokinase release is mediator for pain. Tachycardia is correct. So is not typically seen is the increased systemic vascular resistance because it is decreased systemic vascular resistance because the patient have vasodilatation and the limb is warm. Which receptor does noradrenaline bind to? So noradrenaline bind to alpha 1. Of course, all this related to adrenaline and noradrenaline except G receptor. G receptor is inhibitory receptor in the lung or stretch of the lung. Okay. So this is the last question. I just stop sharing.